The world of cannabis, a global perspective. Cannabis is for 5 P's: people, pets, the planet, for peace, and for profit. Join us and learn about the applications, the various delivery systems, and how cannabis can make this world a better place. A solution which impacts humanity, climate change, and provides a better quality of life for everyone in the world. MD, MPH, FAAFP, MRO, CMS, founder, CEO of Global Health and Hygiene Solutions, LLC Uplifting Health and Wellness, upliftinghealthandwellness.com. From the United States of America, Dr. Dhanabalan.
Namaste. Good morning, good day to everybody. I am Dr. Dhanabalan. Welcome. Thank you everybody for CISW for this invitation. And my topic today is called The World of Cannabis, a Global Perspective. Full disclosure, I am the founder and CEO of Global Health and Hygiene Solutions, which was created in 2006 with a mission to promote wellness and to prevent illness. Also for Uplifting Health and Wellness, which was established in 2014 to educate, embrace, and empower. Our registered trademarks are cannabis, the exit drug, and Dr. Uma says. I am a physician. I did my medical school in New Jersey at the New Jersey Medical School. I did my first residency at the Medical University of South Carolina in Charleston, South Carolina. I then did my second residency at the Harvard School of Public Health, and I did my master's in public health there, as well as a fellowship in heavy metals. I'm a medical review officer and very proud to say a diplomat of the American Academy of Cannabinoid Medicine. I've also been appointed as the medical cannabis expert for the Mass Medical Society and the regional coordinator for the American Academy of Cannabinoid Medicine. I'm very proud to say I today am a doctor that is able to write recommendations for medical cannabis. I do not have the privilege to write a prescription as doctors did. Doctors know that it was written and they had the authority to write a prescription for a medication that was in our pharmacopoeia and listed there from 1850 to 1942. And some of the indications was for the treatment of neuralgia, alcoholism, opioid addiction, gout, convulsive disorders, and insanity. Yes, the treatment of, not the cause of. We also know that the United States of America has the patent number 6630507, which was issued on October 7, 2003. The story goes back to India, where I'm originally from. William O'Shaughnessy first learned about this medicine in India, in Calcutta, from the Ayurvedic doctors. Ayu means life and Veda means knowledge. Cannabis is considered as a sacred plant, and it was used for many, many treatments. We also know that nobody in the world has ever died from a cannabis overdose. Meanwhile, people die from tobacco, alcohol, and even caffeine and aspirin. What was food, fuel, fiber, paper, and medicine was replaced with synthetic, 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 synthetic. And this was all have names: the Hearst family, the DuPonts, the Rockefellers, Carnegie and Mellon, which led to processing of plants that created also pollution. What we also know is that over 25,000 products was known to be created from every part of the plant. What was mandated to be grown in the 1600s was then also a medicine from 1850 to 1942, but it was because of things that was comments that was made, where they made comments that reefer makes darkies think they're as good as white men. It was because of these words that changed marijuana from cannabis to marijuana and prohibition in 1937. We know today cannabis is in Schedule 1, and it's been there since 1970. meaning that the drug has no medical use, no medical research, and a potential for abuse. We also know that this medicine was available in this country, and it was available in forms of tinctures and even things known as asthma cigarettes. Yes, asthma cigarettes. And what was in it was cannabis. We also know that cannabis is much safer in comparison to many other drugs that are out there. There was movies created, Reefer Madness, that changed all of this, and there was a marijuana stamp tax in 1937. Dr. Reynolds wrote in the first issue of Lancet, when pure and administered carefully, cannabis is one of the most valuable medicines we possess. We know that even today. Imagine the world that we could have had if the animals that we consume, the chicken, the pork, the beef, if these animals are consuming hemp, inflammation of the animals themselves would be decreased, and even for our pets, what we feed them. Dr. Raphael Mechoulam, who I've had the honor of meeting, is known as the grandfather of cannabis. In 1964, he started to work with this plant and identified THC as what was known as the psychoactive component. I like to refer to it as the intoxicating component. He also discovered in 1992 the first endocannabinoid known as anandamide, which comes from Sanskrit, which means eternal joy, bliss. In the words of Dr. Damaso, the system is meant for us to relax, eat, sleep, forget, and protect. If any one of these things was not at ease, we would be at disease. I explain the endocannabinoid system in one word: life. And I knew nothing about this system. I had never learned about this system. It was only approximately 11 years ago when I was introduced to this. What we now know is that this system is over 600 million years old. It has evolved from a sea squirt to what we have in humans today. We also know that there's receptors, CB1, which is primarily in the brain, and CB2, which is primarily in the immune system. But we know that these receptors are throughout our body, and that's why one plant works for so many ailments. The first drop of breast milk a baby receives has anandamide in it, and anandamide mimics what THC works with the receptors. That is why it works so beautifully with the CB1 and CB2 receptors. CBD, on the other hand, does not work with the CB1 and CB2 receptors. It works with other receptors that has been identified as TRPV1 and many, many other receptors as well. What we also know is that the endocannabinoid system is very similar to the nervous system. Dopamine and serotonin are made in the presynaptic and released and bind to the postsynaptic. The endocannabinoids are made in the postsynaptic, released, and they bind to the presynaptic. This makes it a very unique retrograde mechanism to bring about homeostasis, to bring us ease. In the words of Dr. Raphael Mechoulam, receptors are made for our body, not because there is a plant out there. What we also know is that cannabis works. Yes, it does. And if we look at any system that there is a disease, the endocannabinoid system is involved. I am an educator, I'm an advocate, and very proud to say also an activist for my patients and also for my clinicians. What I have learned from my experience since 2012 is that the health benefits of this plant, and the lists are just listed for a few things here. Chronic pain helps people to lose weight, gain weight. It helps with depression. It helps with anxiety. It helps mend the bones. It helps with ADHD. We also know it helps people with alcohols, in my experience, with helping people remove alcohol and even decrease it. Nicotine. We know with patients with PTS, we celebrate Veterans Day today, and I leave the D off. It's post-traumatic stress, and that's how we should call it. We also know that it helps fight with cancer. When we talk about cancer, there's 4 specific properties that we want everybody to know. Number 1, cannabis works with the cancer cells, not the healthy cells. It does not let the cancer cells multiply. It does not let the cancer cells spread. It does not let the cancer cells have blood supply, and it causes cell death. The property is known as anti-proliferation, anti-metastatic, anti-agenesis, and apoptosis. We know that cannabis also has twice the amount of anti-inflammatory properties as aspirin, twice as much as hydrocortisone. We know that it works with PTS because increased number of receptors are noted with patients with PTS compared to patients that do not have PTS. Dr. Russo has also found that the endocannabinoid deficiency, patients with migraines, fibromyalgia, IBS, when given a supplementation of cannabinoids, their symptoms and their ailments are relieved. Traumatic brain injury, in patients that suffer from traumatic brain injury, we know that this can help them cope with the symptoms and even prevent the complications from traumatic brain injury. And it comes to the plant. We want the whole plant. We do not want this plant separated, and that is what is important about the entourage effect. Dr. Uma says that this plant is for the 5 Ps. It's for people, it's for pets, it's for the planet, it's for peace, and it's for profit. And your profit is your health and wellness. In my practice, we offer cannabis as a choice in comparison to other drugs. And we know that there can be side effects. The worst side effects that we've seen is hyperemesis, which is most likely related to contamination, but also maybe too much. Side effects can relate to paranoia, anxiety, feeling overwhelmed, ataxia, but we can boldly say you cannot overdose from this. It does not block your respiration or your cardiac. Therefore, no cardiac arrest and no respiratory depression. We know that the side effects of the redness, the mouth effects, the different side effects that can happen, even tachycardia. We inform our patients about drug-drug interactions, especially with blood thinners, because this metabolism occurs in the liver. Anything that's metabolized through the cytochrome P450 can interact. We explain about inhalation, about ingestion, how the metabolism is changed, how inhalation is short-acting versus edibles or longer lasting, and also the duration. We explain about the effects of bronchodilation, the antiemetic effects, that how it helps decrease the pressure, chronic pain, analgesia, antispasmodic, and the list goes on. The modes of administration can vary upon the individual, from inhalation to topicals to transdermal to suppositories, sublingually tinctures, edibles, and beverages. And again, there's one size does not fit all, but there's options for whatever suits you. Even teas, raw forms of the cannabis plant, can also be consumed. There's plenty of literature that has been out there, research reports. We know PubMed has plenty of research. Over 25,000 reports are out there. We also know in the United States, in the states where cannabis is available, 25% reduction in deaths and also opioid deaths related to it. We also know patients prefer this over opioids if it's available, especially with our senior population. What we know is that everything plastic can be made from hemp. Anything plastic from hemp is also biodegradable. Imagine where our world would be if Henry Ford's vision of a car made and ran on hemp. Also imagine that every part of this plant can be used, from the roots that can prevent also phytoremediation, food for all the seeds. One serving of hemp can give you 10 grams of protein, the perfect omega-3, omega-6 ratio. We can make home products. There is so many bioengineering products that can be made, over 60,000 products. We want to see legalization occur throughout the world. What we know is, due to The synthetic products that have been in our society, it has affected our air, our water. It has affected not only the pollution, but also what we have inhaled in our bodies. And it's disrupted the complete endocrine system, affecting every part of our body. Dr. Uma says cannabis is not for everyone, yet it should be a first-line option and not the last resort. I also say, please open your hearts. You don't need to use this medicine, but you know somebody that can benefit from it. We all have an endocannabinoid system, and it is where we need to open our minds. It also helps us open the doors for doctor-patient relationships, because this is very important for doctors to know about the endocannabinoid system and for everybody to understand that this system exists. Dr. Uma uses the word titrate versus dosing. There's 3 rules. Always hydrate before you medicate. Start out low or very low and slow, and make sure you have food on board. And also, very importantly, to journal. Our model here at Total Healthcare THC, we educate, embrace, and empower our patients. And what I'd like to see, and the pillars, are that we need legalization. We need to see laboratory standards. We need cultivation of this plant. Variety of products can be created, and education. My mission is to change the stigma regarding cannabis, for the world to know about the endocannabinoid system, and we do it through education. I look at cannabis for medicine and for industrial purposes. I do not like the word medical and recreational. It again creates stigmatization. Dr. Uma says cannabis cares. It provides a choice for drugs. It provides alternatives for other products that we can create. Research is there, and yet we need more. Education is the key, and this plant provides solutions for the entire world for health and wellness. Cannabis is not an entrance drug. It is an exit drug from pharmaceuticals, narcotics, alcohol, and nicotine. Dr. Uma says, safety first, do no harm. Reach 1, teach 10. As you teach 1, they will reach 10. Thank you. God bless.
Thank you so much, and we look forward to hearing more from you in our discussion panel. Thank you again.
Thank you very much. Good night, everybody.